we do have some good news in the pandemic as well. The UK has approved another vaccine, this one from Oxford and AstraZeneca. ABC News foreign correspondent James Longman is in London tracking the latest there. James, good morning. It's nice to be talking to you about a little bit of good news for once. What do we know about this new AstraZeneca vaccine, and how could the differences between that vaccine and some of the others now approved make such a difference in the vaccine strategy?
Hi, Diane. Yeah, great to speak to you and great to have some good news. And it is significant. The differences are quite significant between this vaccine and the Pfizer and Moderna vaccine, mainly on temperature and on cost. The Oxford AstraZeneca vaccine doesn't need to be kept at those super low temperatures. It just can be kept in a regular refrigerator like mine or yours, which means it's much, much easier to roll out. Officials here are hoping that a lot more people will be able to get this vaccine a lot quicker. And on cost, it is significantly cheaper. The Pfizer vaccine per dose costs around $20. The Moderna vaccine will cost something around $30. This one just between $2 and $3, which means this vaccine is now much more accessible for billions of people around the world. Oxford and AstraZeneca made an agreement when they started out on this thing that it wouldn't be gobbled up by developed nations like ours and like yours, and that is indeed what's happened with the Pfizer vaccine on pre-orders. This one, 1 billion doses have already been pre-ordered by low and middle income nations, so it makes it a lot more accessible for them. And on strategy, well, another big line out of the UK here today is that Britain has changed its vaccine rollout strategy. Originally, you'd have the first dose and then you'd wait 3 weeks for your second dose. We saw Margaret Keenan, the 91-year-old in the north of England, the first person on earth to get vaccinated outside of a trial. She's now had her second dose. Big smiles from her again today. But that now will change in Britain. The authorities here want to vaccinate as many people as possible with the first dose and delay that second one for up to 3 months on both the Pfizer and the Oxford vaccine in order just to get as many people protected as possible. They saw out of the Oxford trials that even after 1 dose of the vaccine, if you waited 3 weeks, you would not go into the hospital with the coronavirus. Now, it won't stop you from getting it entirely, but it'll stop you from needing to be hospitalised. And that's the big issue here, protecting health services. We're seeing them overwhelmed here in London. Hospitals are filling up. You're seeing it over there in the United States. I think people realise they can't stamp out coronavirus altogether, but just 1 dose of this thing can keep people out of the hospital, and that is the aim. So a little bit of good news on what is otherwise a pretty bleak time here. Diane?
Yeah, we've heard a lot of conversation about changing the strategy to that, instead using that 1 dose for as many people as possible. Be interesting to see if the U.S. also follows suit there. Unfortunately, though, here in the U.S., we now have our first detected case of that new strain that we originally saw in the U.K. We know it's been there in the U.K. for a while now. So how are officials treating that variant, and what do you think U.S. officials can learn from that?
Well, fundamentally, I think officials here understand that to treat or to combat this variant, or indeed any other variant of coronavirus, we know there are at least 7 strains circulating around the world, the same restrictions need to be put in place. You need to keep your distance from people. You need to wear a mask. You need to wash your hands. I don't think that anything major can be done really differently than was done ordinarily. And I think that's the major takeaway for the United States. We in Britain and in Europe, we have far harsher restrictions in place, and yet this variant is circulating wildly in the population. So if it comes over to the United States, a place where we're watching from abroad doesn't seem to have many rules in place in much of the country, or at least people aren't necessarily taking them very seriously, the variant and any other new variant in the future could spread a lot. I mean, this one was tracked back to September. That's where they found the original patient had it. It takes about a month to sequence the genome. They realized in October that it was a new variant. It was December before the government changed tack on cancelling Christmas. You remember we actually were going to relax restrictions for Christmas. They changed tack at the last minute. So I think maybe you've only found a few cases of the variant over there in the United States. To completely close down might be something officials in the United States consider, because in Britain now restrictions are really ramping up. We cancelled Christmas. It's likely that New Year is basically off as well. The only things that remain open in Britain at the moment, really, in most of this country, are schools, but there will be an announcement later today, and they may even close as well. So I think it's very clear that this variant is very transmissible. It's not more deadly, it's important to say that, but in London alone, 62% of new cases are from this variant of coronavirus. So it does seem to be replacing the old variant, if you like. And so that is the warning from here in Britain. But as ever, throughout these last few months, Diane, no country seems to want to learn from another, and we all go our own ways. So fingers crossed for 2021.
Fingers crossed indeed. Yet another reason why it's so urgent that we get that vaccine to as many people as possible. James Longman in London. Thanks as always, James. Stay safe.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.